Good evening, everyone. Hello and welcome. My name is Alexandra Alley Wrights, and I am the Academic Program Coordinator of the Preparing the Future program, and I'd like to formally welcome you to the reception of the Leadership in HIV 2013 HIV Summit. Today was a huge day. Really big day. We are just so honored and humbled by your presence to join us, and we just want to celebrate this special occasion forever and ever. Earlier today, over 500 people gathered from around our campus and surrounding community, attending a full day of activities. The summit began with an interactive media display session where our partners shared their collaborative work and how our campus is working together to address each goals of the National HIV/AIDS Strategy on the ground level. At noontime in our plenary session, we heard from Jeff Crowley, who is the former director of President Obama's Office of National AIDS Policy, leader and architect of the National HIV/AIDS Strategy itself, the first of its kind domestically. We learned and we were inspired by him that we can achieve an AIDS-free generation, but we need to do more. We need to keep going and push forward. And I look out on all the faces that I see here today, and I am reminded of the why. We then went to breakout sessions, which were each centered around each goal of the National HIV/AIDS Strategy. We talked about what our campus is doing, and we had candid discussions. We started to dream again. And we're going to see the dreams become actuality into meaningful work, and we know and are confident that that will happen. Here at the University of Maryland, we believe that as an academic and clinical campus, we are at the forefront and we stand with you in order to achieve an AIDS-free generation. We will not forget the lives of the people that teach us every day that this goal is worth it. And I just want to take a moment and honor each of the book contributors. The book, The Life Don't Have to End, has been the inspiration of this entire day. So I just want to honor them. In this reception, we will honor our state's active approach to addressing the HIV epidemic as they stand next to us from state, local, and campus levels. To help us do this, we have invited city, state, and institutional leaders who will share their opening remarks. First, I'd like to introduce Dr. Blattner, Dr. William Blattner, former co-chair of the Baltimore City Commission on HIV Prevention and Treatment, director of the Division of Epidemiology and Prevention at the Institute of Human Virology. So if you'll please welcome Dr. Blattner.
Wow. Is there energy here? All right. Okay, that's really great, I'm telling you. Well, welcome to our neighbors. You're always welcome here. And I'd like to just take a moment. We spent about 10 years meeting on Thursday nights every month. And some of you are here tonight. And if you wouldn't mind standing for a moment, people who've been involved and attended the meetings of the Baltimore AIDS Commission that the mayor set up and helped us develop something special. So those of you who are here, just stand up and really a round of applause. Because the goal that we achieved was really to take the city from a place where HIV was not a priority to make the city accountable so that we could address this problem in a coordinated way. So when we look at the city of Baltimore, the statistic that always stands out for me is that in certain zip codes, people die young And in certain zip codes, people live a long time. And we really need to change that, you know? And the issues that have been addressed today and the multidisciplinary approach that's being proposed really encompasses or encapsulates the fact that this is not a medical problem. It's not a social problem. It's not a poverty problem. It's a person's problem. It's a dignity issue. It's an opportunity issue. And if we don't have a campus that unites the capacities of our schools and the expertise that they bring to bring leadership and insight and approaches to this problem, we're going to continue the generational challenges that we have had in this city. Now, I had dinner with Congressman Cummings. That's not my ordinary dinner, but you know, Bob Gallo, my boss, he kind of hangs out with people like that. And so I was at the table with him. We were on a boat out in the harbor that one of our board members owns. Not Steve Vachati, he had a bigger boat. But we were talking about the challenges of HIV, and we were talking about the challenges that Obamacare is bringing, because we really have a lot of uncertainties as to how all of this is going to play out. And I said, you know, we've learned a lot through the work of the Jacques initiative, of Ryan White, about the fact that taking care of people is not just about coming into a doctor and getting some pills. It's about seeing in that person the soul of that person. We're all God's creation. And He created us for a purpose. And some of us have had opportunities that other people haven't had. And so we have to approach this problem from that perspective. And so I talked to him and I said, you know, in my opinion, Obamacare is not going to work in the city of Baltimore unless we treat patients in a way that the Ryan White program and other approaches like the Jacques initiative bring to the table, which is to really look at the person as a holistic individual who has family, who has children, grandchildren, spouses, lovers, and many challenges associated with the impoverishment and discrimination and the barriers that affect many of the people in this room and in our city. And so the Jacques initiative is a prototype of the kind of program that empowers people to change their lives and to move forward. And we talked about Obamacare Plus, the concept of taking some of the lessons that we've learned through these kind of programs and translating it to the larger picture issues that affect our community. HIV is a huge issue in this community. And you know, I had an education one night at the commission meeting. You know, as a physician, from the beginning of the AIDS epidemic, I was familiar with the fact that HIV and AIDS was a death sentence for many years, and then the drugs came along, and the drugs came along, and now I said, you know, people are living a normal life. It's a treatable condition, like hypertension or diabetes. And one of my community friends stood up and said, "You're discouraging me. I mean, these are diseases that kill in our community. What are you saying?" And I realized it's a bigger problem. We have to take care not only of HIV, we have to take care of the hypertension, the heart disease, the diabetes, the malnutrition, the obesity, all of the issues that we're confronting. And so I think we have an opportunity here to bridge out from a now chronic disease that is now impacting other chronic diseases and start to make sure that we don't become so focused on one disease that we lose sight of the bigger picture and the bigger problems. And so I think this community here tonight and this community here on this campus can work together in the dialogue that 10 years in that room of the commission has taught me. And now our mayor is reconstituting a new group. So our group finished what we were supposed to do. And now a new group is coming in with fresh eyes to take it to the next level. And so I'm very excited about that. Now the final small point I'd like to make, and it is not a small point, is that we're really building bridges. I mean, this meeting tonight is about building that bridge from the so-called ivory tower, which people call academic institutions, to our community, to the people that we really are here to serve. And to make that a bi-directional relationship, not one of power and subservience, but one of equality, so that we're all contributing to each other's benefit. And so that building of bridges has, on a personal level, been kind of interesting for me because I go to a church up in Timonium, and we have a program of ministry, and they partner with Hope Springs. And so now we have young children and people from fairly affluent neighborhoods coming down and starting to have the experiences that you heard about today from our medical students and social work students and nursing students and law students and dental students, of really meeting the community. And when we can start to bridge our communities, we can start caring for each other and start solving these problems. And so I'm very proud of this meeting, which is bringing all of us together. And I just thank the team, Derek, and this whole group who's brought this together. People like Cricket, who's helped to capture. Capture the stories of our lives. And so we just, I'm going to quit while I'm ahead. Now, I'm going to have to excuse myself because I have another meeting tonight with some experts who are actually working on cancer and HIV. And so unfortunately, I'm not going to be here for the other presentations. And I apologize for the fact that I'm overbooked. But I just want to thank you all for being here from the bottom of my heart and for the beauty that I just feel here, that we're coming together, we're going to deal with this, we're going to attack it, and we're going to conquer not only HIV, but all the things that affect the lives, because we have a lot of children and grandchildren, and we want them to have a better life. God bless you.
Okay. Thank you, Dr. Blattner. The next person you're going to hear from is from the Baltimore City Health Department. Ladies and gentlemen, I'd like to introduce you to Dr. Alberta Ferrari, Acting Program Director at the Baltimore City Health Department.
Thank you. Wow, full room. Good evening, ladies and gentlemen. I bring you greetings from the Baltimore City Health Department, from Dr. Babo and Dr. Jacques, who couldn't be here with us tonight. And I'm just so honored to be here, to be celebrating the strides that IHV has made towards the National HIV/AIDS Strategy. And Jamie did a wonderful job of sharing the preparing the future and all the steps that are being taken towards that. Earlier on, we heard from Dr. Gallo, who told us to test, and treat early. And then Jeff Crowley told us, keep HIV on the agenda. And Derek, he said, what is your something? And so I'll take the next few minutes to share 3 key programs at the Health Department and how they contribute to the National HIV/AIDS Strategy. So we have the Ryan White Part A program, we have the prevention program and then a detailer program. The Ryan White Part A program manages $18.8 million, a portfolio of apparently of 17 service categories, from medical services ranging from primary medical care, medical case management, oral health, to support service categories, outreach, medical transportation, childcare, legal, and this one I wanted to remember, housing, just to name a few. So last year, the Part A program, through organizations like yours, served over 10,000 clients. And these are underinsured or uninsured persons. So that's 58% of the HIV-infected persons in Baltimore City, in the Baltimore EMA, which includes the city and the surrounding counties. 6,000, a little over 6,000 were linked to primary care services, and 39% of those persons were virally suppressed. And these are persons who are reached through the Part A program. IHV is one of our partners in this venture, and currently we collaborate with IHV to link former inmates to care, and this is done through funding from MAI, the Minority AIDS Initiative. Part A allows IHV to offer coordinated, comprehensive care to HIV-positive persons who are dually and triply diagnosed with mental health or substance abuse. And the BCHD STD outreach team performs linkage to care for any persons who are lost to care and who have been out of care for more than 6 months. The prevention program, with the aid from the state, performs partner services, testing at events, and locates HIV-positive persons who are released from jail prior to status notification or treatment. And then within the past few months, we gained the Detailer Project, which is our newest project. It's a social campaign aimed at encouraging a little over 500 primary care physicians, these are private physicians, to test for HIV in high-risk areas. So the goal is to have everyone testing for HIV. And finally, BCHD partners with the state monthly on what is known as the Prevention Care Collaboration. And we meet to identify strategies to reach the 18% who are unaware of their disease. And I'm just so honored to be on the same side, on the same team as you. And I thank you, Derek, for inviting the Health Department to be here. And I look forward to hearing your ideas and additional means for addressing this strategy. Thank you.
Thank you, Alberta. I'd now like to introduce from the state level, Deborah Magruder, Director of the Infectious Disease Bureau at the Prevention and Health Administration of Maryland Department of Mental Hygiene. Man, I stumbled over that.
Thank you. Good evening, everyone. Good evening. I'm going to start by, like Alberta said, to tell you that I am so honored to be here, and I want to bring you greetings on behalf of the Secretary of the Department of Health and Mental Hygiene, Dr. Joshua Schorfstein. The Department of Health and Mental Hygiene recognizes the commitment and the fortitude that has enabled IHV to define these new paths in the fight against HIV and AIDS in this state. So we are so proud of IHV and the work that they do. Let's give them a round of applause. I also would like to take this opportunity to congratulate the administration, the faculty, the staff, and the students on your 10-year anniversary of the Jacques initiative. So the interprofessionals who are present today represent a plethora of disciplines, and they all are committed to a Maryland that will lead the way to an HIV-free generation. As we heard this morning in the plenary, that there are socio-economic aspects of HIV/AIDS that include unemployment, poverty, homelessness, stigma, discrimination, and health disparities that have prevented individuals in this state from seeking out testing and treatment. So the messages that we heard today and learning about the activities that are going on should have provided us the energy and the excitement to invigorate us to work towards the reduction of HIV in the state of Maryland. According to the surveillance data that the department comprises, there were approximately 28,200 people who were diagnosed and living with HIV or AIDS in Maryland at the end of December 2011. And this was reported as of the end of December 2012. Now, out of that number, approximately 6,250 Marylanders across the state are infected with HIV, and they are not aware of their infection. So testing is critical. We want to test at every opportunity because we know when people learn of their infections that they provide risk-reductive behaviors. That's how we combat the spread of HIV, by getting folks tested. So working together, our mutual goals must include the determination of increasing HIV testing, increasing access to care, optimizing health outcomes, and to identify cultural competencies and health disparities that impact those bars across the HIV treatment cascade. You know, we're all familiar with the cascade. We know about the testing and retention and the linkage. But what we don't spend a lot of time talking about is those supportive services that move us across that continuum. So the Infectious Disease Bureau is encouraged by the leadership of the Jacques initiative through their current programs and through their new programs that are upcoming. The state is committed to maintaining our partnership with them because we recognize the importance of the provision of HIV care services within the Baltimore City clinics. The Preparing the Future program, Project Shalem, is expanding the community's involvement beyond the scope of the faith-based community by engaging academia to train emerging leaders to integrate HIV into the future practice. This is so exciting. You are unique. You are setting a model across this country. So at the state level, we are extremely pleased about this. We salute your leadership in the areas that link basic science, population studies, and clinical trials in an effort to develop new vaccines and treatments, and most importantly, to find a cure for HIV. In closing, the Infectious Disease Bureau thanks everyone present who has continued to address HIV and AIDS through the years. Warren Venus is an organizational consultant, and he is a pioneer in the field of leadership studies, and he said that leadership is the capacity to translate vision into reality. So on behalf of the Infectious Disease Bureau, please accept our warmest appreciation for your participation in Maryland's effort to lead the way towards an AIDS-free generation. Thank you.
Can we just give a big round of applause for our city, state, and institutional leaders who support us? Thank you so much. I now at this time would like to introduce my boss, Director of Dissemination and Information Dissemination, the brains and the passion behind us all. And coffee in the morning, it keeps us going, Jamie Magnano.
Good evening, everyone. Thank you all for gathering with us this evening. We've had a very exciting day, as you've heard from the previous speakers, and I'm very, very grateful, equally grateful to be with you this evening. In 2009, the Jacques Initiative launched an innovative approach to addressing the HIV epidemic, and that was through community engagement. And all of this is rooted in the core mission of the Jacques Initiative. And I'm really excited because we recently updated our mission statement, I think, to really reflect the importance of community and the importance of the issues that really surround HIV that we're talking about tonight. So I would like to read the mission statement together before we move into the next session. The mission of the Jacques Initiative program is to provide a holistic care delivery model that ensures long-term treatment success for individuals and communities impacted by HIV. Our focus is to address stigma and facilitate greater access to HIV care through community engagement and transformation of individual and institutional approaches to HIV. We are committed to providing a safe place for our clients through clinical expertise, access to clinical research for all, and partnership with the community. We accomplish this mission through the journey to wellness. Thank you for joining me. The journey to wellness. The steps of the journey to wellness, we use these steps every day, and so do all of you, because we believe that all of you are an extension of the Jacques Initiative. In 2009, when we formally launched the community engagement model, we partnered with the faith-based community and trained volunteers to do HIV testing and linkage to care in their communities. And our workforce dramatically became bigger and bigger. Many of our faith-based partners and leaders are here today, and many of the volunteers who serve on a regular basis and have been serving since 2009 are here. And I'd like to take a moment to recognize those individuals that are extensions of the Jacques Initiative in the community, making a difference. We've been talking about the University of Maryland's commitment to an AIDS-free generation, and today the University of Maryland formally committed to an approach to address HIV. Tonight, we'd like to welcome two leaders from our academic and clinical campus to acknowledge this commitment. I'd like to call Dr. Christina Cafeo, the Director of Medical and Surgical Nursing at the University of Maryland Medical Center, who has led our efforts to make HIV testing routine at the University of Maryland Medical Center.
Good evening, everybody. Thank you for having me. So I'm a novice when it comes to HIV. I've worked in Baltimore for most of my career, which is many years. And I've actually worked at both the academic medical centers. I met Derek in my previous life. And I should have known when I came here and I met with him to talk about City Uprising that I would again be working with him. So he came to me about really engaging in HIV, identifying or doing testing in an inpatient setting. So I thought, what a great idea. So we started exploring that at University of Maryland Medical Center. And we got really fast leadership support. It's the right thing to do. Let's go ahead and start this program and really try to help our citizens. So, long story short, we started the journey, and to use some of the words from this morning, we got our champions and we educated, and did more education. I got to tell you, Jacques Initiatives works well with the community, but boy, they are really great at educating healthcare providers. Because guess what? We don't know enough about it. So we were really learning a lot. So I went from being a novice to right now I feel like a more educated novice that I feel like I can really champion. But I'm still a novice. I sit and I'm always surprised. Like I get emails that talk about the different labs. And I'm like, geez, I'm getting an education on the email about labs now. Like everything is an education to me. But I feel now I can walk around and really champion on what our community needs. So It's been a great learning experience, a great journey for me, and a lot of the healthcare providers. So we're teaching the new interns and residents about the disease and why it's so important to treat it like all other diseases they're treating in medicine. And I think we're making a lot of progress there. Empowerment. We went through and we made tools available, did scripting, did a lot of education, and really provided the infrastructure and the processes to help this project be successful in the inpatient units in medicine. And then engagement. So we started with getting champions, and by the end, people were asking to be champions because they were so, I guess it was like the Derek and Jamie and Travis. Where's Travis? He's amazing. He's worked really hard with our group to really, I think their passion really inspired everybody. So everybody wants to be a champion now. People are asking how to get involved. So I think it's a really great thing, bringing it into the academic medical center where sometimes that's the only time people actually see physicians is when they first come into a medicine unit. And Jacques' initiative has made it easy in that they help us make sure that these patients get connected to care. And I think that was one of the hardest parts is to make sure once you do this testing, what do you do? How do you help people to assure they have the appropriate care when they get out of the hospital? So it's been a great journey. I can tell you when we ask people if they want tested, they mostly always say yes. So it's not a matter of asking or trying to talk people into it. People want to be tested. People want to know, and they want to be treated. So we're doing, I think, I'm very proud to say we are doing really well with asking a majority of the patients, thanks to the Jacques Initiative team, trudging us along and pushing us and educating us. And I think it's really successful, and hopefully we're going to move it throughout the hospital. So thank you.
Thank you, Tina. We're equally excited to be working with you. At this time, I'd like to call somebody else up to speak, Dr. Valley Meeks. Dr. Meeks is our Preparing the Future faculty representative at the School of Dentistry and has also been leading the routinization of HIV testing in the School of Dentistry. Dean Mark Reynolds from the School of Dentistry regrets that he's unable to be here tonight, but we're excited, Dr. Meeks, who we work with every day, to represent what's going on our academic campus.
Thank you. First of all, on behalf of our dean, Dr. Mark Reynolds, whose father took ill unexpectedly on Sunday and therefore could not be here as he had planned, I would like to extend congratulations to the Institute of Human Virology's Jacques Initiative and the University of Maryland School of Medicine on their second successful Leadership in HIV Summit. I can personally say that Dean Reynolds has given his wholehearted support to ensure that the School of Dentistry is a part of our campus-wide commitment to an AIDS-free generation here in Maryland. And I know that he extends his congratulations to the Jacques Initiative for 10 years of service to our community. Today's Leadership Summit has truly identified the University of Maryland as a leader in carrying out President Obama's national HIV/AIDS strategy. To reiterate what Alberta said, beginning with Dr. Gallo's historical overview of the evolution of the virus that causes AIDS through the development of a blood test for HIV. In addition, Jeff Crowley, while praising our efforts towards an AIDS-free generation, he has challenged our campus to be creative in our interventions and continue to identify and engage the communities most affected by HIV into care and prevention. Jamie has explained how the community engagement model with community volunteers as the testers was adopted to the academic setting with a coordinated approach to preparing the future through a multidisciplinary approach and collaboration with various disciplines. And then Derek, can't leave out Derek. He's challenged each of us to identify our interests, as Alberta said, our something, and how we can bring our something, our interests, to the table in an effort to bring about an AIDS-free generation. The School of Dentistry's involvement with HIV began in 1989 with the creation of the PLUS program. Since 1989, the PLUS program has not only provided oral health care services to people living with HIV disease in Maryland, but has also served as a major referral center for primary medical and dental care health care providers for the diagnosis and treatment of oral manifestations associated with HIV disease. And then along comes Derek and Jamie, okay? And everyone else at the Jacques Initiative, okay? And they not only asked us, but they encouraged us to step up our game, okay? And step up our game in support of preparing the future. But not only did they ask us to step up our game, they have provided the School of Dentistry with the inspiration and the motivation to be creative in our efforts to step up our game. This past May, as a part of the University of Maryland's multidisciplinary effort in the routinization of HIV testing, the dental school began providing free HIV testing to patients in 4 targeted areas in the dental school: in the urgent care unit, in the screening clinic, in the special care services, and the pre-doctoral general practice clinics. This project also includes linkage to care for those who test positive, as well as initiative of linkage to care for known HIV positive clients who have fallen out of HIV-related care. But like I said, Derek and Jamie, and I'm also going to include Allie, Travis, and Don into this, have continued to encourage us to step up our game and to become creative in integrating the academic side of this idea of the preparing the future. Didactic and clinical training is now offered to the pre-doctoral dental students as well as the dental hygiene students. We have currently 37 faculty and students who have been trained to provide HIV testing through the service learning aspect of preparing the future project. And they're they're wet-fingered. Okay, not only have they been trained, but they actually do the test to some of the patients as they come in. They offer it and they do the test. Okay. So again, on behalf of Dean Reynolds and the entire dental school, we are proud to be a part of this initiative, and we're happy that you came to us as a part of this Maryland as it leads its way to an AIDS-free generation.
So much. Uh-oh usually means trouble. No trouble. No trouble. No trouble. Just a bunch of thank yous. I am to Dr. Blattner, and to Debbie and Alberta, and to Tina. Who did I just miss? Valley. Where'd she go? She messed me up. There you go, Valley. Can't move on me. It's been a long day. I just want to say thank you. We're excited. It's 10-year anniversary for the Jacques Initiative. 10 years. I'll talk about that a little bit later. A couple of, it feels like a couple of years ago, but it probably was longer. About 8 years ago, I was preparing for a very difficult meeting with a funder. And I was stressed, and I had a deadline. And I had a meeting that I didn't want to have with some people that I did not know. And there was about 2 or 3 people. I was being polite. It's one of those things you say yes to, you're just being polite, but you're hoping it's going to be over really quick. Well, one of those people was Miss Nancy Barazzato. We call her Cricket. And for any of you who know her and you're about to know her, Cricket is the right name for her. I was a bit burdened and I was challenged with a program that was blowing up around me. We had this motley crew of about 5 or 6 of us. I did not see down the line that it would be close to 50 of us. But it was 5 of us and we were making it happen. And Cricket boldly ended up exhorting me. Those you know her, Cricket ended up praying with me. And she ministered such peace to me. And I felt like I was ready to do the thing. The thing that I was dreading, the thing that was hard, the thing that was difficult, the thing that seemed too big, she ministered to me and gave me perspective that what I needed to deliver, I already had it. Now, listen, and to know her is to love her. And there are a lot of people in this room who know what I'm talking about. She spoke into me. Star Trek-ish. She spoke into me and she called me to life. And I wept and I did not know her. And I wept in that office. And the rest of the story is this incredible friendship from a woman that is on fire. She is truth. She is real, and she sincerely cares. She does. And so it's a whole bunch of clients. Y'all saying there's a lot of amening going on up in here. But you'll understand a little bit more as you meet her. So without any further ado, I want to introduce to you Miss Cricket Curzon.
I'm not crying yet. I'm going to just take a minute and look around the room because this is an awesome, awesome sight. I feel this evening much the same way as I felt the nights that I delivered my 3 individual boys. There I was, pregnancy, long forgotten, arduous labor and delivery, gone in a moment. The only thing that I experienced those nights was holding my newborn sons and the delight of being a proud mother. And tonight, I have that same delight of being a proud mother. This book, Life Don't Have to End, was conceived in love. This book has love from so very many sources. As Derek has said, I'm a woman who is madly in love with Jesus Christ. It is who I worship. And that was the genesis and the power behind the creation of this book. Secondly, I had the opportunity to pour my love into every single member of the book's contributors and photographic crew. And they were willing recipients. But if you take nothing else away this evening, take this in your hip pocket. The book is not about me. The book is about us. So as I was able to give love and be a love donor, I had the blessing of being a love recipient from every contributor and every photographer, from Derek, from his staff, and from the other people who have had much to do with Life Don't Have to End. The book began, as I said, conceived in love. This woman's been volunteering at Jacques for, let's say, almost 5 years, 4 years plus. And I've been an invited member into a Wednesday morning support group for HIV-positive men and women. And as I've been sitting there through the years, what has happened is I have been changed. The proximity to the men and women who are living day in and day out with HIV was causing me to have to take some scales off my eyes and to open my heart and learn. And as I prayed about the men and women, you guys, as I prayed for you by name, what happened was God deposited the notion of doing a book. Because if I was being changed, guess what? There are people in this audience. There are people in other parts of Baltimore, in Maryland, in Tennessee, in California, in Malawi, all over the world, who would be the beneficiaries of your life and your love. And so I approached Derek, and Derek is a strategic thinker. He took time. How are you going to do it? What are you going to do? I don't know. God told me to do it. And you know what? He's radical enough in his approach to programs that he said, it's on. Game on. So the process, it was really simple. I just prayed. And so I started taking my laptop in the mornings before group on Wednesday and then after group on Wednesday. Beloved Kathy Bennett, who runs the group, allowed me to give the vision. People caught it. I said, we're going global. And they said, yes, we are. and then I was shaking. Oh, no. I would sit with volunteers. What you need to know, only volunteers. No one has made a penny from this book, and no one person will make any money from the book. All proceeds will be divided between the Jacques Initiative and another ministry that does work with the HIV infected in Africa. So I would sit there. I would explain. The process was almost identical, every single volunteer. We would huddle up 2 seats in the vestibule of IHV. No private room for us. People traipsing in and out. There, me with the laptop. I did 2 things. I asked 2 permissions. After explaining the purpose of the book, I asked, number 1, may I please touch you? And I would reach out and I would put a hand on a shoulder, or more importantly, I'd say, may I please hold your hand? And then, once there was touch, I would ask, may I please pray for you? And pray that God would unlock that place deep within where sharing, gut-wrenching pain could truly come forth. I want you to know, friends, every single contributor, Muslim, atheist, and those who are professing non-believers, all wanted touch and all wanted prayer. So we begin. Some people came with their stories already written, pages, 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 longhand. Other people had to have me probe, ask a pertinent question, get them started like you start an engine. I do remember one man. And we sat together. We are post-prayer, and his head was hung low. He would not establish eye contact with me. I asked the questions, still silence. So finally, after several minutes, I said, dude, look, we don't have to do this today. Are you okay? You're not feeling it. What if we circle back around next week or even the week after? Take your time. It's okay. He lifted his head. He looked me in his eyes. And he said to me, Miss Cricket, my story is too dirty. He said, you can't handle my story. And I looked at him and I said, you look me in the eyes. Do not leave me. I said, I want you to know that I have been with your friends and my friends for 1.5 years taking down stories. I have heard of men and women prostituting while they are chasing horrific drug addictions. I have heard of homelessness. I've heard of incarceration. I've heard of every form of sexual molestation and abuse on this planet. And what I want you to know is no story is too dirty. No story. And that your story is my story. And that the love and the pain are the common denominators. And as we share both, we become one. It is the universal story. And there is no way that I will love you any less today after you tell me your story than I love you right now as a human being, because you are, as Dr. Blattner so profoundly said, you are created in the image of God. And, ladies and gentlemen, do understand, God does not make any junk. So we began. From there, 1.5 years went by, and again, in a prayer time, I was given another download, inspiration, if you will, and it was about photography. I am a woman who likes to hang behind a camera and take pictures. And I always assumed there would be a photographic component to the book, but I always thought it would be my portfolio. God had a different plan. The book is not about me. Yes, my DNA is all over it. 2.5 years of pregnancy, believe me. There's a lot of me in it. However, the photography was meant to be Jacques' client's photography. So I knocked on Derek's door a second time and said, Derek, here's an idea, photography, clients. And again, this crazy man said, go ahead, do a seminar. So from July 2012 to May 2013, every Thursday morning, I met with a cluster of clients. Kathia Gray, Lee Nichols, Albert Carolina, Darlene Barnes, and Calvin Peacock joined us as well. To tell you that I loved my time with these fledgling photographers is a gross understatement. We had a ball. And what I want you to know, whether in a classroom environment, learning about theories behind art, photography, the mechanism between taking a picture and bringing it to a reality, to tell a story, to tell a different kind of story about what it means to be HIV positive. I was inspired by them. I was inspired to go behind the lens and see through their eyes. So, what we have done in our book, if you haven't had a chance to look at it, it's laced with what I call picture pages. A picture page is a combination of a photograph and then an excerpt from either one of our group settings or from one of the stories. And my friends, the picture pages are provocative, they are profound, and they are highly instructional. What we learn from these picture pages, is that in spite of the years of hard living, in spite of the years of the pain and the brokenness, deep within the hearts and the souls of these contributors and photographers comes a hope, comes a profound faith, and comes a triumph that is undeniable. I would love to show you a couple of slides just to give you a little taste of what we have. Now it's a little light in here. This is a photograph taken from the Institute of Virology's vestibule. It's a picture of some pictures of key viruses. And what I want you to see, however, this was taken by Darlene Barnes, who was taken ill this afternoon, so she's not here with us this evening. But what we have down here is something that was written by Albert Carolina. Albert was also one of the faithful Jacques photographers. His handprints are all over the book. For those of you who did not get the chance to meet Albert, our family lost Albert on October the 19th. He never got to hold the book. He did get to see rough drafts, and he did get to see his contributions. We also lost another member of our Jacques family over the course of this book being compiled, a man named Glenn T. And both of their families have lovingly consented to the use of their loved ones' work in the book. Our beloved Albert lives on. Read with me. Let me read this to you. Albert says, "I don't look at HIV as a sickness." Can you or can I say that? He goes on more profoundly. I look at HIV as a viral opportunity. And if that doesn't make your head do a turnaround, I don't know what will. If I had never gotten it, I would never have stepped back, looked inside myself, and found all of my gifts. There's a paradox here, my friends. There's a paradox here. The curse of HIV becomes the blessing. The potential death sentence of HIV brings reason to live. And in our next slide, we see that HIV actually is the mechanism for driving people to a radical faith in God. This is Kathia Gray's image, her flowers, and Cynthia R. has given us this. She says, when I think of HIV, it's a monster. And I believe that every man and woman who is in this room, who has dealt or is dealing with HIV on a personal level, would agree with that statement. It is a daggone monster. Does she leave us there? No. There's a transition word there, friends. It says but, right? There's destruction. The thief comes to rob, to steal, to destroy, but do we see this someplace else? But, what does she say? But you can grow to have a beautiful life. I now see beauty. I see peace. I see serenity. I see happiness. I see God. I don't just see HIV. The howling messages of that beloved contributor who told me his story was too dirty. The howling messages are erased in an instant. The shame, the low self-esteem, the stigma. And we learn about gifting from Albert. We learn about beauty from Cynthia. And then Timothy in our next slide. This is a photo we're all familiar with, Penn Station. Blessed Lee, Elliot Nichols has taken this picture. And Timothy S., this is part of his story. It's a poem in the book. And Timothy, I want to give you a little context for this, because you see, you'll read this in Timothy's story. Timothy is a man who presented at Jacques in a hooded sweatshirt. And he just didn't show up at Jacques because it was cold in a hooded sweatshirt. He showed up at Jacques in a hooded sweatshirt because he wore it for a year or longer. He couldn't bear for anyone to see him. So he hid. And then he came to Jacques. And then he touched Derek. And then he got prayed over. And then he saw Lisa in the pharmacy. And then he saw the phlebotomists. And then he saw a treatment coach. And then the hooded sweatshirt came off. It came so off. His hooded sweatshirt came so off that he stands before you today. His words, I am not weak. I am not a failure. I am not too black. I am not too ugly. I am not defeated, and I am not worthless. Because he sees who he really is. He is a child of God. I am stronger now. This is proclamation. I am stronger now. I am successful now. I am humble, and I am free. I would like now for everyone who has contributed to the book, would you please stand, and we have a whole couple of front rows here. I want you guys to turn around so people can see who you are, wherever you are in the audience. All right, I want everybody feel free to be seated, but I want contributors, you stand. You stand. This is your moment. This is your moment. And you turn around and you look and you be proud. You bathe in this. I want to speak on behalf of, clearly from my heart, but also stay standing, from every reader who will touch your book, and I want to thank you. I want to thank you for your courage. You have counseled one another in group, and now your counsel goes out to the world. You have coached us. You have really coached us on what it means to live with chronic illness and not succumb to victimization. Your stories are reflective. You teach us. You are teachers. You have PhDs in the School of Hard Knocks. You have credibility. And you teach us about ethics, about integrity, about values. You teach us about cultural norms and cultural differences. Your stories are universal. Your stories bridge age, gender, and cultural divides. I believe there are physicians in this room, there are clinicians in this room, there are pastors in this room, there are community leaders in this room, and there are future community leaders, pastors, etc. And they will take your book and they will teach from what they have learned from you. I mentioned in the beginning of the evening that this book was infused with love. And what I want you to know is you have done a couple of things. You have taught us what it means to be you. Names, faces, broken hearts, mended places. You have been courageous, you have been bold, you have been raw, you have been real. And you have put the humanity back into healthcare. Too often we think of HIV and we think of disease entity. We think of pharmacology. We think of data. We think of global pandemic. When I think of HIV, I think of Michael. I think of Kathia. I think of Sharon. I think of Thomas. I think of Cece. I think of Judith. I think of Nikki. I think of every single one of you. And I want you to know that your love, this crazy, crazy love that you have going on at Jacques for one another, has very broad arms. And we are grateful. Friends, I want to encourage you. The contributors are all wearing a boutonniere. I would love for you to linger after this. Don't be too quick to leave. Go up to a contributor and ask. Ask a little bit of his or her story. And maybe, just maybe, you'll be blessed and he or she will ask you to share a little bit about who you are. Thank you, guys. Have a seat. I need to take a moment and thank a few people because, of course, I've learned so much from the Jacques clients, but there are many, many, many others from whom I've learned a lot. Dr. Redfield is not with us this evening. He had a meeting in New York, but I would like to say from my heart how grateful I am. Dr. Redfield wrote the foreword to our book, gave the book his blessing, and from him I learned that it was something that he had always wanted to do, and I beat him to the punch. So that's pretty cool to pull one off on him. To Derek, I could go on for hours, and my time is coming to a close. All I can do is say thank you. Thank you for inviting me into your house. Thank you for your courage. Thank you for taking a stand. Thank you for always doing what's right and noble and pure and lovely. Thank you for thinking of these things. Jacques staff, you're around the room. Weekly, I have the privilege of coming into your clinic and observing you. I watch you as you faithfully live out the call that's upon your life to be excellent clinicians, administrators, staff members. What you don't know is what else I am seeing and the other way that you have impacted me. You see what I truly observe, it's your core. And at your very core, you are practicing the art of healing. And that's why this place is so different. It's not that they're better with the science. Oh, they're good. They're very good. But do you know what they're dispensing from their pharmacy? You know what Lisa is handing out in her cups alongside the medications? That Jacques staff is dispensing mercy. That Jacques staff is dispensing compassion. There's a prescription being written there for love and hugs. That's why this place is doing what it's doing, where the state of Maryland takes notice, where they're flying all over the country saying, what's going on? It's the love and the pain, the common denominators, and those Jacques clinicians, those staff members, know it all too well and are willing to enter in with all that they have. For you, I am grateful. There are men and women in the room who have helped to fund this book. There are men and women in the room who have prayed for this book. There are men and women in the room who are my beloved family members. Hello, family and friends. I want you to know that from you, I have learned what it means to do a marathon and to go the distance. To have you stationed every mile marker along this project of Life Don't Have to End with pom-poms saying, you can do it, go, go, go. My beloved John, enough said. Thank you for having the faith and the belief and never wavering from the position that you believed that I would be able to handle the task that God had assigned to me and that I would love these men and women well. Thank you. And so back to that 2.5 years of being pregnant with Life Don't Have to End. There's one member of the Jacques staff, Jamie Mignano. She's already had some applause this evening, but I need to say to Jamie, which I've said to her all along, there would be no book as it is today without Jamie. Jamie was tasked with the responsibility of being the liaison between the book project and Jacques. Jamie poured her love, sweat, and tears into this book. Jamie, on her own time, crazy thing, I get emails from the West Coast, 3 o'clock her time, you know. I'd wake up and my inbox would be full as she was snap, crackling, and popping with other ideas. I refer to myself affectionately as the birth mother of the book. Well, I want you to know that this is the book's doting auntie. So, there's a lot of transformation that has taken place in and through this book, and there's a lot more to come. In my closing remarks, the one thing I would like to do is I would like to address the issue of the title, Life Don't Have to End. Because clearly, when one delivers a child into the world, he or she gives it a name. When one launches a book needs a title. So why Life Don't Have to End? I know my high school English teachers are just mortified. But here's what I want you to know. It is a direct quote from the book. You see, one of our faithful members of group is a man named Calvin Peacock. I can use his last name because he's also a photographer and he's given me permission. So Calvin, week after week, I would be at group and I would approach Calvin and say, hey, Calvin, when are you going to give me your selection for the book? When are you going to sit with me? And Calvin was dear and friendly and would say, oh, Miss Cricket, I'll catch you next week. Oh, Miss Cricket, I'll catch you next week. Only next week never came. So finally, truly about 1.5 years into the project, I was leaving clinic one day, coat on, I've got a laptop over one arm, I've got a purse over the other, and I walk out into the courtyard beyond the clinic, and there was a cluster of clients talking, having a smoke, and I said, hey guys, bye, I'll see you next week, and they said, hey, bye, love you too, and just as an afterthought, I threw it out there, and I said, hey Calvin, maybe next week you and I can sit together and I can get your submission for the book. Calvin dropped what he was doing. He left that group of clients and he came right over to me. And Calvin could get in your face, and he did. Calvin got in front of me. I actually had to take the stand back, you know. And he said, he put a hand on a hip and he started a little finger wag and he said, Miss Cricket, here's what I want you to put in your book. I want you to tell those readers, life don't have to end. He said to me, he's like this, he said, I don't care. HIV negative, HIV positive. You tell those people life don't have to end. I got to my car, I quickly jotted it down, and then I went home and entered it into the manuscript. But then it started working on me in the middle of the night, and I've got to pay attention to that. And I started to think of my beloved family member who has horrific heart disease. And I thought of my neighbor who has a battle with diabetes that leaves her crippled and partially incapacitated. I thought of all of the relational wounding and friends that my husband and I are privileged to pray for right now. I thought about you. I thought about me. And I thought about Calvin's statement. Ladies and gentlemen, it is a summary. One man's simple yet so poignant and profound, his contribution to the work of 64 others. He would have you and he would have me understand, in the presence of HIV or even without HIV, there is always hope. And hope does spring eternal. And that's the gift that these men and women give to you. They want you to take from tonight their belief that life don't have to end. Thank you.
Kathy Vargin here. Kathy, did you hang around? Hey, Kath. So now you know cricket. Now you know cricket. So listen, I'm going to ask you guys to give us 12 minutes, and we're going to close. I was listening to cricket, and I was thinking, I wrote down 4 short words, when we say yes. I had no idea a couple, I don't know how many years ago, 15 years ago, volunteering at a substance abuse group at a local church from my own pain in my life of not being able to help somebody I love with drugs. I thought, let me go help somebody else. And in that meeting, I got sensitized to the needs of the community. And in that meeting, I had this grand desire that I was going to work in a clinic serving the uninsured and underserved. And I went back to school by faith. I had 3 kids, a wife, and bills. And one day I made a mistake and I said I had 3 kills. That's kids and bills. And I went back to school full time, and I had no idea that it would lead to some of the opportunities as I just moved forward, and I said yes to what was in my heart. And I just say to all of you, to the book contributors, when you say yes, you had no idea that your story will be shared at this level and help this many people. Cricket, when you say yes, just to give your life away and to spend time and just to share yourself with people. I didn't see any of this today, but I'm really, 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 really grateful and honored to be a part of this story. Much of this only happens because there is this incredible staff at the Jacques Initiative. And we're done in 10 minutes. We started with this motley crew of myself, a preacher's wife, a friendly pharmacist who will say I lied to get her to work for the Jacques Initiative, and 3 brave folk who were willing to give their story away. And so I just would like for Lisa Langer to stand. I'd like Harriet Kapalakisha to stand. Remain standing, Lisa. I want Kathy Bennett to stand. And I want Gene Chance. Where's Gene? There, whoop, there he is. And so, this little motley crew would sit around the table, just about 4 or 5 of us, and we would rotate. We worked 7 days a week because we did directly observed therapy. And so it was a Monday through Friday schedule, but the problem is we were a 7-day-a-week program. And so we would cut off a little bit early. Instead of leaving at 5, we would leave at 4 because we had to work the weekend. And we would be there on the weekend, and medicines were hard, and people were sick, and people were really sick, literally, once they took their medicine. But we did it, and the next year they moved from like 4 of us to about 6 of us, and then the next year we moved from 6 to about 10, and moved from about 10 to 15, and we laugh, and I wish I could make myself sound smart and say there was a strategic plan. There was no strategic plan. All we did every year was try to meet the needs of the community. What can we do better next year to serve our clients? And we would have the faith to write grants. I couldn't spell grant. I had no experience with the grant. And we are so fortunate to have the trust of the state and the Baltimore City Health Department and be one of the biggest recipients of brown white funding in this city. And so it is based on service. And so I want to ask the 3 directors of this program, and ask Jimmy McNano, who's our Director of Development and Information Dissemination, to come forward. I'm going to ask Ms. Ashley Sargent Rock to come forward. And I'm going to ask the smooth Mr. Chris Williams, who's our Director of Case Management and Mental Health Services, to come forward. And so what I'd like to do is just take a minute, if you would allow us to acknowledge just an incredible staff. And I'm going to ask Mr. Tim Shepard to come forward. And Tim, what I'm going to ask, because of time, that you would read the names of our staff, and then some of y'all sat far back. You must want attention so we can watch y'all walk from the back. Attention-seeking behavior. So Tim, I'm going to ask you to call names out, and I'm going to ask the staff to come forward. And we just want to shake your hand. We want to say thank you, and we have a small token of our appreciation, just because we love you. That's all. No, nothing else, other than we just love you. Tim.
All right, Dr. Anthony Amoroso. Michelle Bito. Miss Kathy Bennett. Travis Brown. Happy birthday, Michelle. Happy birthday. Sarah's in here. Sarah? Yeah, Sarah Bussey. She had to leave a little early. Mr. Gene Chance. Miss Lynn Credit. Charles Davis. Angela Duvall. Miss Liz Ellis. Sierra Fox. Seth Hemlock. Jennifer Houston. Dr. Jennifer Houston. Shanita Jones. Miss Harriet Kalpalakisha. Miss Harriet, I'm sorry, I messed up your last name a little bit. Don Kirk. Dave LeMason. Miss Lisa Langer. Vanessa Lathan. Dr. Thomas Macaria. Jamie. Curtis Mitchell. Allie Wright. Miss Cynthia Richardson. And we have the lovely Miss Ashley Rock. Julie Rodriguez. Patrick Rascavage. Sarah Shamaus. Miss Judith Shaw. Miss Dawn Snowden. Dr. Leonard Sawal. Dr. Derek Spencer. Miss Kelly Stewart. Wanda Waters. Miss Tina Watts. Dr. Jeff Weaver. Miss Jeree White. Mr. Christopher Williams. Denise Hopkins. Chris Robeson. Hazel Jones Parker. DeRay Warren. And last but not least, Linda Kokich.
So listen, in the last 5 minutes, if you are a couple of things. I want to just say thank you to the staff for all you do. We're missing about 7 or 8 people, but we've grown just based on service. And what makes us great leaders is that we serve. And we'll never forget that's what makes us great leaders. I want to give some special acknowledgement and embarrass a couple people. First, I want to embarrass Miss Allie Wright. She left. Come. You didn't wear that shawl not to be seen. You know you want to be seen. There you go. Fantastic. Can I call forward the energetic, the powerful Cricket Barazzo? Can I call forward the auntie, Miss Jamie McNano? If you are a family member of one of these staff, would you mind standing up? If you're a family member of the Jacques staff. If you're a family member of any of our staff, you're a child. I don't know why my children not standing. I don't understand. Okay, if you're a family member. Listen, just remain standing. To the family members, we appreciate you. It's not easy being connected to us because we're full-time. And my wife, when I call her previously on her phone, how my number would come up, it would say Moses. And she said, I did not know that I was marrying Moses. And so I'm going to give my wife flowers, but this is for all of the family members here. We appreciate you very much. Wife, come receive us. That's okay. I've been crying all night. We're done. I want to just make a simple appeal. First of all, I want to say that, again, you've heard me say this today. I feel like Jacques has the largest staff in the United States who deliver HIV care. We literally have 500 active volunteers who help us to do the work we do. I'm looking at Aaron, and I'm looking at Cricket's friends who are my friends. I'm looking at Cricket's sons, and we've ate dinner together. I feel like I'm part of a family. To Tina and to Debbie, just so many people. Valley, I can't name names. Jacques has a strange presence. We don't think we're just a clinic. We believe that we have responsibility to the community. And so Lorraine, see, it's dangerous. To Debbie, I need to stop. Let me do this. We are appreciative of our community members. Our clients have poured their life out, and I am learning every day to be more honest because of them. I am learning that it's possible to have great promise and then also to have great challenge, and how to walk in that and to be honest and not to walk in condemnation and not to walk in shame and not to walk in guilt. I learned that lesson. They teach me how to be great. And I know many of you have purchased this book. How many people in this room have purchased a copy of Life Don't Have to End? Okay. And so this incredible work is a seed. It is inspirational, and it is our way, it is our clients' way to give themselves away so that somebody else can be blessed. I realize that this is bigger than HIV. This is just about living well. It's about facing difficulty and having faith to believe that your life is bigger than your situation. I tell my clients, whatever you're going to do it on purpose. And I am saying to you, to on purpose make a commitment to getting this book for somebody that you love, somebody who needs to be inspired. And I'm asking you to make that commitment tonight. And I don't want to sound like I'm begging, because I don't have to. It is, people's blood is on this page. They have given their heart out. And so there are tables set up so that we don't have to worry about a cramped table. But if there are people who tonight felt anything, if you felt some sense of inspiration, I am boldly asking you to sow in this moment. I'm not saying, you're going to go home, you're going to think about it. We're not making a lot of, this isn't going to keep our clinic open, right? But it is a way for us to give something away far greater than just words on a page or any money that we would give. I believe that it will be a blessing to this community. And so can I mess with you? Can I mess with you? There are people in this room that felt inspired from when you heard Miss Nancy Barazzato. That would be cricket? Yes? Can I get a couple people? I want you to hear me first. Can I get a couple people who will say, I heard and I want to respond tonight to purchase a copy, another copy. I thought I was just getting one, but I want to get 2 more. Can I get a couple people who in this moment will say, I'm going to make a commitment now in this moment? You can stand. Go ahead and stand. Some of you are standing and remain standing. This isn't about you. This is not even for you. You want it for somebody else. Are there other people in this room who in this moment want to sow into this work? Wife, stand up because we're going to buy some. Yes. Are there? Yeah. Yes. Yes. Okay, we're in the last call. Please remain standing. There'll be tables set up. John, where are you at? The husband man. He's already outside ready. Okay. Last call. Are there people who want to respond in this moment that you want to sow a seed in somebody's life to let them know that life don't have to end? Maybe their situation's financial. Maybe their situation has to do with depression. Maybe their situation has to do with a kid. But in this moment, you want to make a decision. Okay. Let me say thank you for those of you who stood. And let me ask you, this is a moment. I'm going to ask you to put some movement to it. We're done. I'm going to ask you to go to the table, make the purchase, buy 4 or 5 books. Thank you so much. Have a fantastic evening. Oh,
wait. 1 second. One more minute. Just, I'm quick. But it's no way we can let the night end and not acknowledge Derek and what he is to us. I don't do a lot of crying. I can't believe it. I don't do too much crying. But Derek is so much to all of us, and we are just so appreciative to be able to come to work and feel a part of a team, and just to feel the love and support that's genuine through all of our situations. I don't know how he handles it. I feel like Derek is the go-to person for almost everybody. All of our problems, client, staff, and he's just awesome. So Trina and girls, we definitely appreciate the fact that you lend your father and your husband to us, because he's more than a boss to us. And I couldn't imagine my life without him. And I know everybody could say something, and we don't want to hold you here any longer, but I guess if everybody just want to say we concur, and we love you so much, and thank you.